Hi, I'm Kelsey Thompson, and my clinical group and I decided to discuss the utilization of compression devices in healthcare, comparing sequential compression devices and thromboembolus deterrent stockings.
In healthcare, the topic of compression in relation to diseases and the differences and similarities between each device used is rarely discussed. Studies have been conducted to evaluate the effectiveness of sequential compression devices and thromboembolus deterrent stockings, yet articles rarely compare and contrast the devices. Compression is commonly used on the lower limbs to maintain blood flow for prophylaxis or use with deep vein thrombosis, pulmonary emboli, and major risks of bleeding.
Two common devices used as discussed are SCDs and TEDHOs. TEDHOs are anti-embolism stockings that impair peripheral limb blood flow and wound healing by applying a light amount of pressure, which has caused discrepancies and contraindications with leg wounds. TEDHOs compression ranges from 20 and below. They're most commonly used in patients who are immobile or bedridden, have many other surgical conditions, surgeries such as total joint replacements, old age, history of smoking, pregnancy, obesity, and a history of congestive heart failure. SCDs, on the other hand, can customize compression cycle time by sensing venous filling time, and this may allow for more venous compressions than with the utilization of TEDHOs. SCD compression ranges from 20 to 60. Typically, they're used in patients who are more often ambulatory, staying active, or standing for long periods of time. They require intense pressure to aid in treatment, or if they have venous conditions such as lymphedema, venous deficiency, varicose veins, and many other conditions.
A venous thromboembolism occurs when a blood clot forms in veins and arteries, and it can present as either a deep vein thrombosis, or a DVT, or a pulmonary embolism, also known as a PE. With limited movement, blood can pool in the veins and arteries, causing insufficient blood flow and can cause a blockage. DVTs and PEs may be prevented through the use of compression stockings, TEDHOs, or sequential compression devices, or SCDs.
Apply around bilateral lower extremities and inflate sequentially from foot to knee for SCDs. They are meant to be worn while the patient is in bed or sitting in a chair. In comparison, compression stockings are placed in morning when edema is lowest to increase ease of application. You should have the patient sit in a chair with a firm back support and rubber gloves to firmly grasp the stockings. Pull the stockings up to the thigh while minimizing wrinkles in the hosiery when the knee is bent.
Patients may be provided with SCDs or compression stockings because of being postoperative, or they cannot ambulate themselves. Compression stockings and SCDs are effective in maintaining blood flow, so these blockages can occur.
In randomized controlled trials and observational studies evaluated via a meta-analysis, the study from SAGE journals aimed to validate the efficiency of IPC devices in the preventions of VTEs in critically ill patients. Deep vein thrombosis is evaluated using a Doppler. In an intra-participant randomized controlled volunteer study, both sequential and single compartment intermittent pneumatic compression devices were compared. In another randomized controlled study conducted by Wang and Lee, 112 orthopedic patients were evaluated using Doppler sonography to detect VTEs with and without the addition of SCDs and graduated compression stockings pre- and post-operatively. In a systemic review using 20 randomized controlled trials, graduated compression stockings, either alone or in conjunction with prophylactic methods, was studied. 10 of these studies included patients in general surgery. 6 included patients in orthopedic surgery. 3 included patients in neurosurgery, cardiac, respectively, and the remaining trials studied medical patients. In another analysis by Chibaro, assessed the effectiveness of a combination of elastic stockings and LMWHs in neurosurgical patients. In an informatical literature review, Cateas and Menica compared the effectiveness of SCDs and compression stockings and discussed the Caprini model. Finally, in a 14 eligible randomized controlled trials and 3 eligible observational studies written by Julcia Pavone in the Journal of Arthroplasty, explained the effectiveness of ICP devices for venous thromboembolism prophylaxis in high surgical patients. Now on to Victoria.
Next, I'll be discussing the Comprene risk assessment model and the types of patients that typically use these devices. The risk for DVT and pulmonary embolism can vary greatly depending on the patient. Many attempts have been made to create an assessment, and the most widely used and accurate model is the Comprene risk assessment model. This model is used by physicians and other healthcare workers to attempt to score the risk of each individual patient. Deep vein thrombosis and pulmonary embolisms are a major concern for hospitalized patients. The scale was used to classify the baseline and different factors that a patient may have. This scale judges aspects of a patient including family history, medical history, age, surgical type, and medications prescribed. The points are added up on the scale and the patient is given a score that matches the risk of either very low to very high with different points of risk in between. The scale is commonly used when a patient is undergoing almost any type of surgery, especially if the risk is increased because of pre-existing conditions. It is very common for a patient to receive some form of DVT prevention, but some types of surgeries can put a patient at less or higher risk. I analyzed the common types of postoperative patients commonly seen on the medical surgical unit. For example, patients undergoing laparoscopic abdominal surgery, neurological procedures, and patients with non-extensive trauma are considered moderate risk with a typical score of 3 to 4. For example, these patients are typically diagnosed with an acute appendicitis, abdominal obstruction, or intracranial hemorrhage. Patients undergoing these surgeries typically receive a compression device and some other form of DVT prevention. Those that are considered high risk are patients undergoing major cardiac or thoracic surgery, intensive thoracic or abdominal surgery, and major trauma involving the brain or spinal cord. For example, these patients include the diagnosis of peripheral vascular disease, aortic distension, stenosis of the bilateral carotid arteries, and congestive heart failure. These patients are always given compression devices and other forms of DVT prevention, including medications and frequent ambulation if possible.
And now for the results and conclusion. The study by Y. Wang, M. Wang, and Huang from Sage Journal showed that IPC group significantly reduced the VT incidence compared with no thrombophylaxis group. And the IPC group also showed lower VT incidence than the graduated compression stockings. In the next study, the RCT study by Wang and Lee, 9.84% of the control group with only GCS developed a DVT in comparison to only 3.92% of the experimental group with SCDs and GCS. And then for the post-hoc analysis suggests perioperative IPC devices are a non-negligible support in the prophylaxis of clinically symptomatic DVT and PE. In the next study, the effectiveness of IPC written by Pavon were compared to anticoagulation for major clinical outcomes, and the risk ratio was 1.39, which was a 95% confidence interval. The VTE risk compared with anticoagulation alone, and that IPCD compared with anticoagulation may lower bleeding risks. In the systemic review of graduated compression stockings prevention of DVT, Shasdeva finds that within the GCS group, 134 out of the 1,445 units ended up with DVTs, which was about 9%, compared to 290 out of 1,408, which was 21%, within the control group without GCS. In the last study, Dokudis and Mekita showed the use of SCDs alone were more effective than no prophylaxis in the prevention of DVTs. So in conclusion, the DVTs and PEs are highly preventable complications of ICU patients. Various devices have been used in efforts to limit this complication. According to studies, both SCDs and TED-HOs have shown significant results in the prevention of DVTs and PEs. The goal of these products is to minimize venous stasis of the lower limbs and decrease the risk of major bleeding clotting. Thank you and have a good day.